we start, I'd just ask everybody to go on to mute if you're not speaking through the session, just so we don't get feedback. And we're going to record this session, so if you don't want to be recorded, turn your camera off. And we've got a very tight agenda today, so if there are questions people have, if they could put them into the chat box, and we'll make sure that we respond to those questions. But if everyone could go on mute, that would be great.
Let's go on mute.
But maybe Auntie Jane, keep yours on, because you'll be speaking very soon, and then go on mute after that. So good afternoon, everybody. We'll kick off. My name's Andy Giddy from Westvic PHN, and I'm being your host today. So I'd like to welcome you all to the official launch of the SPIDAH Foundational Project on today.
Sorry, love it. Come on.
5th day of May.
Okay, I'll call you a bit later.
Yeah, and if everyone could go on mute, that would be good. And maybe Chloe, if you can mute people, that would be great. So without further ado, I'd like to invite Auntie Jane to give a welcome to country. Over to you, Auntie Jane. Are you there?
Sorry, Jane, you're just on mute.
There you are. I'll start again. Sorry.
Perfect. Go ahead.
Hi, everybody. My name's Auntie Jane, and I'd like to begin by paying my respects to all the different cultures around Australia that's on Zoom today. I'd like to begin by paying my respects to the traditional custodies of this land, where we are meeting upon today, for its elders and past and present, and even for the self-advocacy people who have passed away and who are still here today on Aboriginal land. Thank you, everybody. When I do that, sometimes when I include the whole of Australia with different cultures, with, you know, their tribes and that, sometimes it gets me off the line, you know?
Yeah.
Yeah.
No, that's perfect. Thank you very much, Auntie Jane. And you can go on to mute again now if you want. So thank you. On behalf of Westvic PHN, I'd also like to acknowledge the traditional owners and custodians of the lands and waterways on which we work. The Wadawurrung, the Gulajan, the Gadibunud, Kirre Wurrung, Peak Wurrung, Gunditj Mara, Jabwurrung, Watchabullock, Jarja Wurrung, Jadwajali, Wagaya, Jupagolk and Jadwa peoples. We recognise their diversity, resilience and the ongoing place that First Peoples hold in our communities. We pay our respects to the elders both past and present, and commit to working together in the spirit of mutual understanding, respect and reconciliation, and we support self-determination for First Nations peoples and organisations. We'd like to acknowledge the many lands on which we are meeting virtually today for everyone in attendance. I'd also like to acknowledge the people with lived experience of a disability, as well as their families, carers, disability services and advocates. We recognise their strength, courage and unique perspective as a vital contribution to our work to learn, grow and achieve better outcomes. We recognise that people with disabilities have the right to the enjoyment of the highest attainable standards of health without discrimination on the basis of disability, and have the same rights as every other Australian to have safe, effective and high quality healthcare services that meet their needs. Now, just a content warning today, we've got 4 presenters speaking today. There may be some topics which are emotional or personal stories, so if anybody needs support, please seek that. So to the agenda for today, I'll give a brief background on the SPIDAH project and I'll explain what SPIDAH means. We have 4 guest speakers today: Helen McCarthy, Margie Steffens, Nikki Stifel and Rebecca Patton, and then I'll all be giving a brief presentation or discussion. And then we'll do the official launch of the SPIDAH foundational project, and we'll just briefly dip into that. And then we'll make available to everybody access to the report and the easy read version of the report. So just briefly about Western Victoria Primary Health Network. We cover 21 local government areas and represent around 620,000 people. We're a not-for-profit organisation with the majority of our funding coming from the Commonwealth Government. Our role is supporting general practice, including Aboriginal medical services, commissioning or purchasing locally needed services, and integrating local services and systems to make the primary health services better for all. I'd like to acknowledge that Australia is a signatory to the United Nations Convention on the Rights of Persons with Disability, and Article 25 of the Convention states that parties recognise that persons with disabilities have the right to the enjoyment of the highest attainable standard of health without discrimination on the basis of disability. And it's important to note it's talking about the highest attainable standard, not an adequate standard. Briefly, what is the SPIDAH Project? SPIDAH stands for Supporting People with an Intellectual Disability to Access Health. We chose this name for the we chose the spider web as the image to support this, and you may see in Kerry and Nicole's background they'll have the spider web there, and it shows how we see the connection and nodes across the healthcare system. When we talk about access to health, our particular focus is on the primary healthcare system. So what is the primary healthcare system? It's really the first point of contact into the health system for any individual. So this is the doctors or GPs that we see, nurses in clinics, allied health professionals, mental health professionals, dentists and oral health professionals, pharmacists, Aboriginal and Torres Strait Islander health practitioners, and receptionists and administration within these facilities. And we particularly call out reception and administration because often that is the very first point of contact for a health episode coming into a facility. So they are an area of focus for us as well. This project is funded as a stream of a new resource called the National Roadmap for Improving the Health of People with Intellectual Disability. This is a project that was launched towards the end of last year by Minister Hunt. And what's exciting about this is it is a 10-year commitment to improving access to health for people with an intellectual disability. One of the streams under this program is the Primary Care Enhancement Program, and that's the program that is funding our SPIDAH project. This 10-year plan has a steering group that meets 4 times a year to make sure that what's written in the plan is actually achieved, and I'm a part of that steering group. So, enough about the early part. Let's talk to some of our guest presenters. So the first presenter is Helen McCarthy. Now I'll stop sharing my screen, and Helen can, if Helen's going to use slides, no, Helen's not using slides, so she can just speak. So Helen McCarthy is a senior lecturer in dietetics at Victoria University. She trained in the UK as a dietitian and spent the first 15 years of her career as a children's dietitian in Belfast and in Manchester. Her research interests include the early identification and management of nutrition risk and malnutrition, and she believes in access to food, education and skills for all, and to this end has developed and delivered community nutrition education programs in the UK and Australia. And these are focused on developing food literacy in families, children and vulnerable adult populations, and more recently has expanded to include support for staff and volunteer workers supporting adults with intellectual disabilities. So Helen, I'll hand over to you, and just remember to come off mute.
Yep, thank you very much, Andrew. Hi everyone, and thank you for the opportunity to speak today. As Andrew has said, my background is nutrition and dietetics, and as a paediatric dietitian, I've spent a lot of time working with children with a range of disabilities, and I've always seen that as a great privilege, because when I'm talking about them, I'll always talk about my families and my kids, because I did feel that I had a responsibility to them. And at the same time, they always called me, most of the kids used to refer to me as Auntie Helen, and would have, I would have got invites to birthday parties and all sorts of things. I was an extended part of their family, because that's just the way I've always worked. Since coming to Australia 7 years ago, and my role is now as an academic. I'm a full-time academic at Victoria University, and I teach nutrition and dietetics students. But I've more recently taken on the role of, what's the official title? It's co-director of learning and teaching, but basically means I have my finger in all our allied health courses at Victoria University, which has given me a fantastic insight into how we actually train our nurses and our allied health professionals to work in the community. And with my background interests and the research that I'm co-participating in, that's being led by our PhD student, Monica Wellington, that's also in this meeting today. The way we train our students to actually go out into the community and work with people with disabilities and their families and the people that care for them, for want of a better word, is lacking. And I'll probably get shot by somebody for saying that, but I was fortunate enough to get a sneak peek of the report that's being launched today. And the standout things for me from that report was the massive disconnect in how health professionals viewed their ability to communicate, their attitudes towards people and families that are living the experience of disability, the way they participate in interprofessional and multidisciplinary care for those people, is so far removed from what the people that are living that experience are actually feel about it. Health professionals think they're good at communicating. Well, I know for a fact not all of them are. Some are good, some are not. Working in multi-professional teams, some do it naturally, some need a little bit of support to be able to do it. But what the report highlights for me is the fact that I need to actually make a change in the way we train our students to be able to come out and to work in the community with people more effectively, more efficiently, to be able to communicate with them better. And by communicate, I don't just mean talk at, I mean listen, because that to me is ultimately one of the most important parts of communication, if you just take a step back and listen. As Andrew said, my background is nutrition and dietetics, so I have a particular interest in nutrition, and basically I work on the philosophy that nutrition and food is everybody's business. It's not the preserve of the accredited practicing dietitians, who are, yes, trained as experts in that field, but they can't be everywhere. They can't be everything to everybody. So we have a duty to actually support and train other professionals to be aware of the types of nutritional problems that may present, and the basic steps to how to address those or refer them on appropriately to somebody that can help, because not all nutritional problems need a dietitian to fix them. I'm also acutely aware that supporting families to have better understanding of food choice, of how to support the people that they care for with disabilities, be it adults or children, to have healthy access to food, access to healthy foods, the ability to make healthy food choices. And I'm not a healthy eating, if you could see me in person, you'd know I'm not a healthy eating advocate in a huge way. I believe people need to have a healthy relationship with food. And if you have a healthy relationship with food, then you'll do what my granny, my Irish granny, always used to say, which was all things in moderation. And eating all things in moderation allows you to have a balance. And it's not just in your diet, but I actually apply that to when I'm working with individuals and families, to the advice that we're giving. And when we're working with education, and Monica's research is looking at how do people access nutrition services and what nutrition services do they need, looking at adults with intellectual disabilities and the families and carers that support them. One of the big questions we're asking is, what do people actually need? How do we encourage them to be able to choose appropriately, to be able to access the help that they need? And so our relationship with the SPIDAH Project, and I'm going to finish up on this, has come about fairly recently, but is actually a massive opportunity for us at VU to get better insights, and me to use that to improve how we train our students, to work with families to actually look at how we can improve training staff in practice, and actually how we can provide additional opportunities to support families and individuals going forward. So I just say this is a fantastic opportunity, I think, for everybody that's involved, and I'm really, really grateful for the opportunity that Monica and I have to be part of that. Thanks.
Thank you very much, Helen. That was really, really good, and it's great to have you guys involved in the next phase of the SPIDAH project. So our next speaker is Margie Steffens, and I think, Margie, if you want to start sharing your screen, if you want to present some slides. So Margie's research has been focused on vulnerable populations, including Indigenous, homeless, refugees and the elderly. She completed her honours in 2013, and the topic was associations between self-reported discrimination and oral health among young Aboriginal adults. She has found passion in her work to develop sustainable oral health care access for vulnerable and marginalised people, and advocates for these communities. She's part of the Dental Hygienists Association of Australia and is the past National Chair for Aged Care, and is a representative on the National Aged Care Alliance and current chair of the Special Needs Special Interest Group. So Margie, I'll hand over to you.
So, yes, you're really trusting me to get this share tray open. Wish me luck. Anyway, while I'm fiddling around trying to find it, I thought I'd had it open there, but obviously not. Nicole, did you have it there that you can pop it up?
Or Chloe, maybe.
Or Chloe?
Yeah, we'll get Chloe to share her screen. Perfect.
That would be really nice if you did that, because there we go. That's much better if someone else does it for me, because I'm not terribly good at this sort of thing. Can do things on Zoom, but Teams is a new thing for me. But anyway, thank you very much. So thank you so much for inviting me, and in particular the Dental Hygienists Association, to be part of this very, very important project. Can we have the next slide, please? And I would like to share this with you. I came upon this when I was doing my research, and it really resonated. And it's about home. And I think all of us deserve and need a place to call home, irrespective of who we are. So this fellow is a poet and a writer living in New South Wales. So today we stand in footsteps millennia old. May we acknowledge the traditional owners whose cultures and customs have nurtured and continue to nurture this land since men and women awoke from the great dream. We honour the presence of these ancestors who reside in the imagination of this land and whose irrepressible spirituality flows through all creation. And just as an aside, I shared with Auntie Jane before, I've just come back from Catatuja and Uluru, and this is just so much about what that country is like and how it's the very heart of who we are, and for so many people. Next slide, please, Chloe. So something that I thought is worthwhile that we should should consider in all things, and Andrew, you alluded to this before, that we do have an Australian Charter of Healthcare Rights. And I won't bore you with reading through it because you're all intelligent people and you can see it there. But I think that the important things are access to care, safety of care, respect, communication, and Helen, you have really touched on some of those very important areas, is the communication and the respect that every individual should be afforded. Participation, and that brings us into our health professionals being involved intrinsically in these areas of great need. Privacy is something that we all need to respect, and comment, that every individual has the right to make comment about their particular type of care that they believe that they need. So you'll have access to this slide. I'm very happy for you to share that. Next slide, thanks, Chloe. So thank you again. And I think this is a great opportunity that I have been offered. I think I was involved in some very early conversations with our CEO, Bill Suhan from the Hygienist Association of Australia, and with Nicole and Kerry. Thank you very much. And you've enabled me to share some of my project experience. So my job, I've worked in special needs dentistry for over 30 years as a dental hygienist, and then went on to some more study and manage a clinic now for people that experience homelessness, disenfranchised, refugees, asylum seekers, and do a lot of teaching with undergraduates in these areas of need. And having worked in special needs for so long, you see people aging over time. And I think this is a very difficult area when we're considering intellectual disability, that support structures are perhaps better when you were younger, but as you get older, where do they go? And having sitting on the Aged Care Alliance, it became very evident that as people age with intellectual disabilities, particularly when they're around 64, 65, where do they go and what support services are there for them? So I've been able to share some of the experiences I've had with setting up a couple of projects, which is terribly important to me to see some sustainability, and I feel very encouraged by what you people are doing, and I look forward to seeing what happens in the future. But we do need to include a range of professions, and I think over my years of working, it's become patently evident that from a dental perspective, we need to work with you dietitian people, because that's terribly important, Helen. I think you can line me up with you to face the firing squad about the educational capabilities that we have in place. We need to share lectures, we need to share our ideas, and we need to share, cross-pollinate each other with dietitians talking to dental hygienists and oral health therapists. We need oral health therapists, dental hygienists talking to the dietitians. So we need to really mix and match our professions much more intrinsically than we have in the past. We've got to stop working in silos. We need to create communities, and this is what you're doing, is pulling all these people together. So I really take my hat off to you for asking advice from so many diverse people, that creating these communities. And if I think about the outreach program that I've been working with now, it's 11 years, of, let me tell you, a lot of very hard slog, a lot of heartache, and a lot of very anxious moments when you think, where's the next dollar going to come from? But what's really impressed me is that the more people that you engage with, the more people that you include into these projects and programs, the richer it becomes, and the more access that you give people who really need the care. Your 6 themes, really, accessibility, workforce is so important there. So with thinking about accessibility, reasonable adjustments, that we need to think about how we get people to places, and people living in rural and remote areas, as you've identified, it's particularly difficult. And we find that dentally too. How do we get to these people who are living in remote areas and have some sort of disability? The Dental Hygienist Association, and certainly a lot of us and myself, I belong to the Australian Society Special Needs Dentistry, and that's linked in with the International Special Needs Dentistry. And at the moment, there's some discussions happening about intellectual disability and access to dental care. So this is, you know, kind of a nice little thing that's happening in Australia at this point. So we shouldn't feel alone. We're just sort of at a hand's reach from each other. Mental health was an area you looked at, that we need to consider the providers' mental health issues as well, because it can become very stressful working in these spaces for a prolonged period of time. We need to think about, again, Helen, the education that we need to provide for our healthcare providers to look after themselves so we can be better healthcare providers for people who need our support. And creating safer communities, well, that's education. Education for the providers and for the recipients of care. We need to become, as healthcare providers, educators primarily, to teach people, to support people. And we need translational research. We've researched so many areas to death within an inch of their very lives, but we need to actually make it applicable to the reality and the care that people really need. Preventive care. Now, from our perspective, certainly from the dental hygienist OHT perspective, is that preventive care is very cost effective. And if I think back to some of my patients I've seen for probably over 20 years now, nearly 30 years for some of them, who have chronic health conditions, without the support and education, they would have lost a lot of their teeth. But what we've put in place, and our unit in particular, is very strong about prevention. And that's something we need to go back to, a minimal intervention approach, a preventive approach, and an educational approach. And we need Medicare for dental. So let's hope something happens with the election. And interface with other sectors. And again, this is where we need to work in. Allied health professions need to get together and form a coalition where they share educational capabilities and share and become actually engaged and involved with the teaching in the different spheres of health. And on that note, connecting health professionals, I've said that, diabetes, dental, and of course dietitians. Ageing with disability and access to care and waiting times has been a chronic problem with dental. And I looked up some stats just recently, and most of them, it's about 24 months for general dental care. I had a quick look at some disability information here from the AHIW, the Australian Institute of Health and Welfare, that around 1 in 6 people in Australia have a disability. Some people with disability experience difficulties accessing using health services. You know that. And barriers can include longer than desired waiting times, the cost of services, and the accessibility of buildings, and direct or indirect discrimination by health professionals. And I think when we think about the discrimination there, I think a lot of health professionals, it's a little bit of fear of the unknown and really not knowing how to address these issues. Hence, we go back to education. And just quickly, 1 in 8 who need to see a dental professional are placed on public waiting lists. This is talking about people with disabilities. 7 in 10 who have been on a public dental waiting list wait 1 month to more than 1 year before receiving dental care. And 3 in 10 who need to see a dental professional delay or do not go because of cost. This needs to be fixed, and maybe we're starting to move into the right direction with getting some better services there. Thank you very much.
Thanks very much, Margie. Really good insights there, and it certainly oral health is a theme that has come up in the project. So our next speaker is Nikki Stifel. Nikki is an accredited mental health and social worker and behaviour support practitioner. With a passion for working with people experiencing a range of life complexities. She's currently employed as a Disability Liaison Officer at Grampians Health Service, which was a role that commenced in response to the COVID-19 pandemic, starting in August 2020, with the aim to support people with disabilities access COVID testing, treatment, and eventually vaccination, as well as assisting with supporting people with disabilities to access other health services within the hospital. And just our own experience at West Vic, having the DLO roles created in the health service has been so important to the whole COVID vaccine response. So thank you, Nikki. I'll hand over to you.
Thank you. I don't know if I have much else to say after that. That's my intro just pretty much described everything I've been doing for the last 2 years. So thank you for having me here today. I did have an email from Kerry, I think, where she wanted it, where it said the things that we're supposed to, and because I've had my internet drop out and it's just not been happening today, I can't seem to find the discussion topics. But so my role as a Disability Liaison Officer started, I'll just go back to the beginning, in August of 2020. We were employed across all of the health services in the state to assist people who were potentially not accessing health care services because of COVID, as well as helping with testing and treatment. And our initial focus was really on the disability accommodation providers. So we did a lot of work early on engaging with the Department of Health and Human Services, as well as the specialist disability accommodation providers, to make sure that they had infection prevention and control assessments and measures to take place. And over time that developed in sort of like a few outbreak management plans, some training sessions, engagement with the providers around other health needs that weren't being met. So we were able to sort of expand our approach based off of what we were seeing or what we weren't seeing in the health service. And then the vaccination program came about. And prior to that, it was just me and then one of my colleagues in Stall, who was 0.7 EFT. So I was only working 4 days a week. And then we also were able to bring on three more people on a part-time basis to provide support with vaccination activities, which was really, really good. And we were able to start vaccinating in April of 2021, where we would have specialist disability days within the vaccination center, or we would do outreach to places like McKellum or Melba, and some of the other providers locally. And in addition to that, my role I have another job where I work part-time as a behavior support practitioner, which is why Kerry and I were discussing me talking a little bit about what a behavior support practitioner does. For those who might not be aware, sorry, I just kicked my cat. Sorry, poor thing, she's just got in my way. It kind of intertwines with the work that I've been doing at the Vaccine Hub around, looking at people's sensory preferences and trying to adjust how we approach people living in the community, as well as those who come into the health service, and try and support them so that they're enabled to have access to health services, and anything that's implemented and brought into their environment is suitable to their sensory needs and their social needs. So a lot of the work that I've been doing around behavior support has quite significantly overlapped with what I've been doing at the health service, and it kind of feeds into each other. For those who aren't aware, positive behavior support is about looking at people's behaviors of concern, whether people are hitting themselves or hitting other people, being verbally aggressive, withdrawing from usual day program activities. And it's actually looking at how do we support them and what can we add to their environment, or what can we remove from their environment to make it more suitable for them, so that it's not the behaviors are less likely to occur. So instead of using you know, older strategies like coercive control or punishment, we're actually saying, okay, well, this person has specific sensory needs. What can we do to support them? An example of how we intertwined the two roles was that there was a gentleman who came to our service with a disability who had very specific sensory needs. We were able to take his behavior support profile and provide it to the ward prior to using a disability liaison screening tool, which we created here at the health service. Well, it was actually created at Monash Health, and we adapted it to Ballarat Health. And we provided that to the ward, and they were able to put him in a space on the ward that was going to be less loud, because they had originally said, well, he has high care needs, we should probably put him near the nursing station. So instead of actually putting him near the nursing station, they put him towards the back of the unit where it was much quieter. He had a much better experience. At the end of the experience, he actually didn't want to leave and packed his, like when the staff were packing his bag to go, he was like putting his stuff back in, like he wanted to stay at the hospital a little bit longer. So I think, you know, overall that was a very positive impact for him. DLOs are officially being refunded through the State Disability Action Plan. So we only found out via Dan Andrews' page, which was, I think, announced yesterday, but we don't know how many DLOs, we don't know where they're going to be placed, for how long. We don't know any of the details at the moment, but we are waiting to find out. So when we do have more details, we can let you know. I personally am finishing up in the DLO role at Ballarat Health at the end of my contract, and I'm going to continue doing behavior support at private practice, and also continuing to see clients through Medicare. But yeah, that's pretty much our job. That's me in a nutshell and what we do at the health service. And please feel free, we do have an email address, disability, I'll pop it in the chat. That will still be active, as well as a phone. We can still help with vaccination activities for COVID-19. At the moment, we don't actually have any planned activities for flu vaccine, but I think that the PHN might have some things in the works. So yeah, thank you.
Great, thank you very much, Nikki. And as I said, DLOs have been critical to that whole COVID vaccine rollout. So thank you again. So our final speaker today is Rebecca Patton. So Rebecca is a proud parent of a daughter with multiple severe disabilities and complex needs. Rebecca has worked as a volunteer member of several disability and inclusion advisory groups for more than a decade, and also in promotion of Changing Places and the Touch by Olivia Foundation to create the Victoria Park Inclusive Play Space. Rebecca has a background in education and is currently employed as the Strengthening Parent Support Program Coordinator for the Central Highlands region, supporting families of children with disabilities. So I'll hand over to Rebecca to talk.
Okay, thank you. Now let's see if I can get this to share okay. There we go. We're working? Yep. Excellent. Yeah, so this is me, and those two are my main reasons for being. I have two daughters. Sarah, as mentioned, has multiple profound disabilities due to a rare chromosomal difference. So she has 2 extra copies of the short arm of chromosome 12. And she has a younger sister, she doesn't look younger because Sarah's so small, who is typical in most ways. Yes, so I have come to the SPIDAH Project as a volunteer, but I do also work part-time as the Strengthening Parent Support Program Coordinator for Central Highlands. That is a statewide program, so there are parent support coordinators right across the state, and we meet regularly for networking and professional development through the Association for Children with a Disability. If you'd like to know more about that program, the link is there. So we're under DFFH funding, and it's a free service to any families of children with disabilities. We can provide individual support as well as I run several peer support groups. There's a list there of the various groups that I'm currently a member of, lots of advisory and advocacy groups. I did add in that I am on the Memorial Concert Band at the bottom just because I do have a life outside of disability sometimes. But yes, coming from an educational background, it was interesting to hear others mention the importance of improved education for pre-service practitioners. My Masters of Special Ed research thesis was on looking at the impact of parent perspective presentations to pre-service teachers, and that was actually quite interesting. The way that we could change the views of pre-service teachers about what they were going to encounter in the classroom in terms of dealing with children with disabilities and their parents through just having those conversations with them. Anyway, I'll move on. So we have a range of primary health care experiences. As you can see from there, we've had some wonderful experiences and we've had some not so wonderful experiences. We access a wide range of supports for our daughter, Sarah. I've lost count of specialists. I've lost count of surgeries. Our life is pretty much lots and lots of appointments. And sometimes it's great, sometimes it's not great. So I've been asked to share some examples. In particular, the example I'm going to give is around dentistry. Our first experiences with dentistry and Sarah were actually really positive. There was a dental van that came to Ballarat from, I think it was based from the Royal Dental Hospital. It was kind of nice. I didn't really need to know that. They just contacted me. Initially, they were coming through the specialist school and then they were based at one of the disability care providers. Dr. Nick Baker was amazing. They always had plenty of time for us. Although they were in a dental van, it felt like there was enough space. They managed to make us feel welcome. They had time for us. Sarah used to giggle sometimes during being checked out. It was a really positive and lovely experience. Unfortunately, in September 2019, they were coming twice a year to our area, so we'd see them every 6 months. The September holidays 2019, we missed them because we were away on holidays, and so we were planning to see them again around Easter 2020, and I think we all know what went wrong then. So we didn't see them for a while, and then I found out that Dr. Nick Baker had retired and the dental van was no longer a thing, which was very disappointing. So it was COVID. I wasn't really wanting to make any appointments. Early 2021, I got a message from the school saying that they had a dental program coming to the school to check the kids, and I signed the paperwork. So I said, yes, fantastic. I wasn't sure what to do after the dental van wasn't around anymore. This would be a good option. And then I got a note back after she'd been checked saying that they'd like to follow up and that I needed to make an appointment. So I did that in due course. And about 8 weeks later, we had the appointment. And it was a really busy day. The appointment was right after school. So I'd got Sarah straight off the bus, literally off the bus, straight into our wheelchair van. I'd organised someone else to pick up my other daughter from school. Having been at work and done all the things, it was a pretty busy time. And I got to where I needed to be, found the accessible car park, got her out and everything. And I got in there and there were 2 dentists there, but I don't know who was who. They didn't introduce themselves. So there were 2 people there. One could be a dentist, one could be a dental nurse. I don't know who was who. It wasn't easy to work out where Sarah should be. So I asked whether they would like to help me transfer her to the chair, and they sort of didn't really seem to have an idea of what they wanted with that. So I ended up tipping her chair back because it does tilt, and they worked that way for a while. Partway through, they asked if Sarah had ever been to a dentist before, and I mentioned the dental van, and they didn't seem to know anything about that. And I almost felt questioned as to whether or not it existed, which was really uncomfortable. Then they asked if we were brushing her teeth regularly, and yes, we were doing our best to do that. Wasn't always easy. And then suddenly halfway through, well, what felt to me like halfway through the consultation, she was there specifically to have her teeth checked and cleaned. They stopped. They just suddenly stopped and said, okay, we don't have time to do any more. You'll have to come back. And so that was a surprise. I didn't expect that. I thought that we were here to get a job done. It had been a lot of effort to get her there. And then as I was going to leave, one of them passed me this little card and it said OH on it. And they said, now take that out to reception and make your next appointment. So I took this little card out to reception and said, they said to give you this and I need to make the next appointment so they can finish the job. And the lady at reception said, oh, you need to see the oral health educator before I can make you another appointment. And I felt awful. I felt like I know how to do her teeth. I know what I need to do. And they could have just spoken to me. I am now facing 3 appointments instead of 1 appointment. I have NDIS going on. I have other things going on. I was under a fair bit of stress and I felt judged. I felt that my time wasn't valued. I did not want to go back there. So I had to make the appointment. I made the appointment and I made it for a day when my husband had an RDO and I sent him. I was not feeling like I want to go back there and I still don't ever want to go back. I actually found a private dentist that I prefer and I'm using that service instead. So that is an example of the differences that a service can make. I have driven to Melbourne to find the dental van when they weren't able to come up here because that service was so wonderful. And yet this other service that exists in the town I live in and is free, I have no intention of going back to. And if it was my only option, if I didn't have the ability to use a private dentist, that would be interesting, I guess. I don't know what would happen for other families in a similar position. Maybe the healthcare of their child might be detrimentally affected by that. So moving on, what do we need? We need to feel welcome. We need to feel understood and supported. So what that means is if you're running late, let us know. If you're running early, let us know. Make sure your appointment is long enough to make allowances for the fact that our kids have additional needs and won't necessarily fit into your nice little box that you expect for every other person to fit into. We need good physical access. So with COVID, it's actually improved because there's spaces between chairs in waiting rooms, but we've often felt like when there's no spaces between the chairs, Sarah in her wheelchair seems to be in the way of everything. So we feel like we're in the way, we're being tolerated rather than welcomed. It's uncomfortable. It's like sometimes she can be noisy and she has interesting behaviours. It's not a place we want to be and we just feel like we're in the way. So if you can somehow make it easier for families like ours to feel safe and to feel welcome, that would be appreciated. And the other thing is that recognition that this appointment that we're at with you is one of many. And there's been an awful lot of juggling and logistics in terms of getting to that particular appointment. For some families, they might have 3 or 4 kids and only one of those is the person having the appointment. It's really hard. Sometimes we have to cancel other respite services and things so that we can do what we need to do to get to the appointments we need to have. I'm meant to make an appointment today as a phone call. I keep putting off because I know that I'm going to have to go to my calendar and find time to fit that in. and I just don't want to. It's hard work. So having that recognition of the pressures that are on families outside of your individual sphere, I think is really important. And I often say that that's with me. I'm going to stop this now. I am the best case scenario. I have a background in disability. I have my Masters of Special Ed. I have all the support networks. I sit at work, I sit with the support coordination team, so they know the NDIS backwards, forward, sideways. I have access to them. I have all of my children's grandparents live within 20 minutes of us. I have a great circle of friends. I have all of the support networks around. I'm your best case scenario. If I find something hard, then everyone will. So I sort of use myself as a bit of a litmus test, and that's probably why I'm so active in a lot of these groups, because I feel that if I don't speak up when I probably have more capacity than most to do so, then no one will. So I'm not sure exactly, I can't remember exactly how SPIDAH found me because I am in so many networks, but it has been another great chance for me to share those experiences and perhaps maybe make experiences better for other families like ours along the way. So I hope that made sense. Thank you.
Great. Thanks very much, Rebecca, and thanks for sharing your personal experience. I mean, it's so important, and I think you make a great point that you've got all of those options available to you, and you know you're maybe unique in that way. And for everybody else, it's the hurdles just monumental, and I know they're difficult for you as it is. So thank you very much. So we're going to move on now to the final part, which is actually launching the report. So I'm just going to share my screen again, and we'll move. So now we're moving to the official launch. So this is what the report looks like, as well as the easy read version of the report. And both of these are going to be published on our website as we speak. And I'm sure we'll put a link in the chat so people can directly access it as soon as we finish today. So these documents will be up there. So I just want to talk a little bit about how we got there to this report. One of the most important things is this has been developed with the community and working locally with the community. So this is working with people with lived experience, working with their family, their carers, advocacy organisations, service providers and the wider community. And no doubt Rebecca was found during that process. So what has the SPIDAH team done so far to get to this foundational report? There's been meetings with community members between August and December last year. We've done surveys, we've done workshops, we've done emails, we've had discussion groups in big forums and small forums, and just many contact points. And you know, Kerry and Nicole are to be congratulated with the scope of what they've achieved. In those discussions, the questions that we asked was, what's working well, where it is, what's not working well, where are the gaps, and what are the ideas or opportunities for improvement in the system. So distilling all that sort of feedback down, we came to the 6 key themes that Margie was referring to. And there's more detail on each of these in the report, which I'll encourage you to have a look at. But the 6 themes were accessibility and reasonable adjustments, the workforce availability and capability, mental health came up as a key issue, creating safer communities, preventive health, and interface between systems. So they're the key themes that came out of the report. And what's going to happen next, because this is the foundational report and we have a project that's running through until 2024, is what do we do next? So what are we doing next? There's going to be big focus on resources and whether that's to support individuals, family members, carers, support service workers, primary care physicians, etc. Development of resources. Related to resources is training. So training is going to be a big component of what we do next. And then we're going to do some experimentation. So we're going to do some trial activities to see how we can improve the system and make it work better for everybody. So some of these things that we try will work and some won't. So what we're going to try and do is a range of activities, and these are detailed at a higher level in the back of the foundational report. So you have a really good idea of where we're trying to go next. So I want to finish there and thank you for attending the launch, and really encourage you to click on those links and go through and access the documents. We feel they're very accessible. There's an easy read version to go through as well. And we really look forward to working with everybody who's been part of this project to date and expanding that sort of circle of support as we move forward. So thank you very much, and thank you particularly to our presenters today. It's been really great to hear your insights, and I want to particularly call out Kerry and Nicole, who are the backbone of the SPIDAH team, for their fabulous work and engagement. So we'll stop there today. Thank you very much for attending, and I wish you all a good rest of the day. Thanks very much.